Liver health 5 ways to help reverse grade 1 fatty liver in 60 days. Grade 1 fatty liver, where liver cells contain a surplus of fat roughly 5 to 10% above normal, usually goes unnoticed because rarely it produces symptoms. However, left untreated, it can quickly progress to the next stage that can be dangerous. The good news is that usually grade 1 fatty liver, which is non alcoholic, usually does not need any medication, and some lifestyle tweaks can naturally reverse this condition in 60 days. Let us have a look about it. Grade 1 fatty liver, also called as fatty liver, marks the first stage of non alcoholic fatty liver disease. At this stage, 5 to 10% of liver cells are packed with fat, which causes the organ to appear brighter on imaging studies such as ultrasound. The condition is typically silent, and many individuals never realize that have it till it comes up in a routine test. Yet, without any intervention, this modest fat accumulation can set off a cascade that leads to inflammation, fibrosis, or even cirrhosis, ultimately inflicting damage on the liver. Nonetheless, evidence points to the reversibility of this phase through lifestyle shift, refined choices, regular physical activity, and disciplined weight control, marking early identification essential for healthy outcomes. Losing weight in a gradual way tops the list of effective ways in reverse grade 1 fatty liver. Evidence shows that dropping down 7 to 10% of your overall weight can markedly cut liver fat and dial down inflammation. However, trying to lose weight quickly can actually worsen liver health. So, a realistic target of rupees 1 to 2 kgs per month achieved through a healthy diet and regular physical activity. This moderate weight loss not reduces buildup in the liver but also improves enzyme levels, helping the organ to heal in mild fatty liver cases. A diet filled with fiber, whole grains, fresh fruit, vegetables, and the right kinds of fats that can potentially reverse fatty liver in as less than 60 days. For this, choose foods like legumes, dark leafy greens, whole fruits, and a modest handful of nuts. Swap out refined carbs bread, white rice, refined flour for brown rice, whole wheat or multigrain ones. Likewise, choose good fats found in the oil, avocado, nuts, and seeds, steering clear of saturated or trans fats. Pulling back on added sugar and processed foods helps keeps level stable and blood glucose in check, which in turn curtails the buildup of the fat in the liver. For that reason, the Mediterranean dietary pattern is often recommended as it can be help the people to lose weight and reduce fatty liver. Home remedies like various plant based herbs and supplements can give the liver as a boost and keep fat in check. Milk thistle, turmeric, dandelion roots, green tea extract abundant in catechins, and lysoris root all carry anti inflammatory action that shield hepatic cells and support detox pathways. While these botanicals are intended to complement, not replace, broader lifestyle tweaks, a few clinical studies suggest they may promote liver regeneration and trim fat in cases. A steady habit of green tea consumption has been linked to reduced liver fat and a modest boost in liver enzyme performance. And the last is give up drinking. Even a modest amount of alcohol can aggravate a fatty liver, so steering slashing consumption is a key. Fatty liver can also lead to diabetes, excess weight, and high cholesterol. Addressing those conditions through a doctor's prescription when needed, diet tweaks, and moving more gives a liver a fighting chance. Keeping blood sugar and lipid levels under control curbs buildup and the inflammation that follows. Regular doctor visits and liver function panels let us watch the numbers and fine tune treatment as things evolve.